On behalf of EuroChem, it is my pleasure to warmly welcome you to this important webinar. So my name is Adrianne Wald. I work as a pain nurse and acupuncturist in a regular hospital in Belgium. And I'm also at the board of the European Traditional Chinese Medicine Association, ETCMA, and the EXCO member and coordinator of the members of the European Parliament, MEPs, Interest Group on Integrative Medicine and Health, EuroChem. So today we will focus on a pressing global health challenge that is recognized as one of the major health issues, antimicrobial resistance, so known as AMR, and is affecting human, animal, and environmental health. As antimicrobial resistant bacteria cannot be contained within the borders, it underlines the need for concerted action to address AMR. This week, we celebrate the World AMR Awareness Week. This is a campaign launched by the WHO to raise awareness on the issue of AMR. The week launched this Monday with the European Antimicrobial Awareness Day. The theme of both of the events this year is Educate, Advocate, Act Now, pressing on the importance of patient involvement and educating the public about AMR, calling for stronger targeted policies and action to prevent the spread of drug-resistant infections. Building on last year's G20 recommendations to include traditional, complementary, and integrative healthcare, TCIH, in global One Health efforts, this webinar will focus on how TCIH and cross-sectoral collaboration can strengthen EU strategies. So by reducing antibiotics overuse, promoting prevention-based approaches, and diversifying treatment options for infectious diseases, these efforts not only address immediate health concerns, but also contribute to long-term strategies. As highlighted by the European Commission on Monday, research makes progress behind the scenes. We are therefore so grateful to today's speakers to bring their expertise to shed light on the scale of AMR, explore contemporary strategies to enrich current approaches, and advance the implementation of One Health principles. While evidence supporting the role of TCIH in AMR exists, increased efforts and investments are essential. This aligns closely with our broader mission to promote health, which must include the environment, as well as being sustainable, as emphasized in EuroChem's new Refocusing Health project. EuroChem represents patients, practitioners, doctors, and veterinarians within the field of TCIH. So together we promote how TCIH can contribute to addressing critical health challenges like AMR and advocate for its integration into the European health systems to support sustainable and innovative solutions. We are also proud to partner with the Charité Competence Center of the Charité University Hospital in Berlin. This collaboration underscores the importance of TCIH research and also paves the way for the upcoming initiatives of the MEP Interest Group to continue delivering value to European institutions and, most importantly, European population. I would like to give the floor to Dr. Hiba Bujna of the Charité Competence Center on Traditional and Integrative Medicine in Berlin. So please, Hiba, the floor is yours.
Thank you very much, Adrianne. Good evening, everyone. Good morning, good afternoon, wherever you are in the world. Warm welcome from my end from Marrakesh, where I am at right now attending a conference on urban health. And my name, and I will tell you in a second why I'm sharing with you where I am and what I'm doing. My name is Dr. Hiba Bujna, and I serve as the head of international cooperation and partnerships with the Charité Competence Center for Traditional and Integrative Medicine, referred to as CCCTIM. And it's my distinct pleasure to celebrate with you the AMR Awareness Week today through this webinar, where we really try to explore the role that traditional and integrative medicine could play in combating antimicrobial resistance. I was sitting in one of the sessions here in the conference that is about urban health, and the reason why I'm here, it's because we at the CCCTIM think of traditional and integrative medicine as a broader effort towards holistic health and well-being. And I heard one of the speakers was sharing about the use of inefficient cooking methods in a lot of places in the world where we don't have access to clean energy. And there was mentioned that the exposure to harmful fumes at the household when we don't use clean sources of energy could really cause a lot of respiratory diseases, whereby a lot of people go to the pharmacy and get off-the-counter antibiotics for things like this. And it made me think, and of course the linkage was made with the AMR, this excessive use of antibiotics for things like this that we might sometimes not think about. And I was thinking to myself, wow, this is making me think even more how relevant our webinar is, because when you think about it, you think about these traditional medicine grounded recipes and therapies that could really bridge some of these gaps to really provide alternative treatment ways to things like this, where we don't need to go get an antibiotic, when we can seek well-being and healing from other sources. And of course, at the CCCTIM, what we aim to do is to really build evidence for traditional and integrative medicine therapies. And that's why we believe that we have potential to collaborate in the fight of AMR through evidence-based traditional and integrative medicine knowledge. I'm really pleased to be here. I do think that this webinar is very innovative and creative, and it's really a testament of how thinking outside of the box could look like. Particularly pleased with our partnership with Eurocam. We had another webinar on integrative oncology earlier this year, and we are very happy to close the year with this important webinar. So I hope that this webinar brings you some insights, some exciting conversations. I hope that you find the presentations of our brilliant speakers useful, and thank you for being here. Over to Tito, who will moderate our conversation. And thank you, Adrian, and thanks everyone for being here.
Hello, everybody. Thank you, Adrian and Hiba. My name is Dr. Tito von Schönanger. I'm the president of the International Federation of Anthroposophic Medical Associations and the president of the Traditional, Complementary and Integrative Healthcare Coalition. It's my great honor to moderate now through this session with the fantastic speakers we have. And with no further ado, I would like to introduce you to Dr. Dominique Monet, who is the head of the Antimicrobial Resistance and Healthcare-Associated Infections section at the European Centre for Disease Prevention and Control, the ECDC. Dr. Monet leads the program focused on AMR and healthcare-associated infections. And before he joined ECDC, he worked in French hospitals and at the US Center for Disease Control and Prevention and at the Danish Statens Serum Institute. So over to you, Dr. Monet. We look forward to your presentation.
Thank you very much, Dr. von Schönanger. So let me share and start. I would thank you for the invitation, but I would also remind the audience that as an EU agency, the European Centre for Disease Prevention and Control, ECDC, does not have a mandate on medicines in general, and including traditional, complementary, and other medicines. So we have a mandate for doing surveillance on antimicrobial resistance, on antimicrobial consumption, and I will focus on this as elements of background for your work with traditional medicines. Let's start with an idea of what it represents for the EU. We have a mandate for the EU and Iceland and Norway. So we made modeling from our surveillance data to estimate the health burden of infections with antibiotic-resistant bacteria with a focus on the EU. And we found out that in 2020, there were more than 800,000 infections with these bacteria. These would result in more than 35,000 deaths that would be directly attributed to infections, more than 1 million years of life that would be lost because of premature death or because of disabilities, and more than 70% of this burden was linked to infections in healthcare, hospitals and other healthcare settings. Once I say this, for the EU, in the EU as it is among the high-income countries, this health burden remained comparable to that of influenza, tuberculosis, and HIV/AIDS combined. And it increased between 2016 and 2020, and there was a small decrease that we saw between 2019 and 2020, and most likely because of the COVID-19 pandemic. The burden of the diseases and of the infections is not equally distributed between healthcare-associated infections in blue and community-acquired infection in green. You see that more than 10 times more infections that happen in the community, but the burden in terms of disability-adjusted life years, DALYs, or death directly attributable to this, is disproportionately happening for healthcare-associated infections. If we put the resistant infections in the picture, you see that this very small number of resistant infections overall for the EU, as per our estimates, that happen in the community and much more in hospitals. And then again, the burden of the resistant infections is disproportionately happening in hospitals and other healthcare settings. So these were numbers, these were modeling evaluations that we did. But we make a point at turning, at saying that the burden is actually the life of patients who are being affected by these infections, and we found some that are actually ready to tell what was their own story, what happened to them, and how did they live through these infections. So we have been collecting over the years patient stories. We have 3 new patient stories of people that have been nice to give us their testimony. Rosa, Gavin, Ira, I invite you to go there and watch the videos, read the stories. They speak more than any graphs that I've been showing you at the beginning of this presentation. In June last year, the Ministry of Health adopted Council recommendation on stepping up EU actions to combat antimicrobial resistance in a One Health approach. And for the first time, these include targets that the EU, and the EU being as good as the sum of its member states, there are also indicative targets for each EU member state. So there are 2 targets on antimicrobial consumption, 3 targets on antimicrobial resistance. And of course, our task at ECDC is to make sure that now that the targets have been adopted to be achieved by 2030, then ECDC monitors every year the progress of the EU and of member states towards the targets. So the first target is about the total consumption of antibiotics, and this is combining community, which is 90% of antibiotic use in the EU, and the hospital sector, which is the remaining grossly 10%. And you see that while there has been a decrease during the first 2 years of COVID-19 pandemic, we've been catching up in terms of antibiotic consumption. The dotted line indicates the direction towards the reduction target of 20%. And you see that by 2023, the EU overall was at plus 0.6%. So alert, we're not going in the right direction. We need to do more. This differs a lot depending on the countries. One country actually already reached the target by 2023. It's indicated in green. The countries indicated in yellow are progressing towards the target. There's been a reduction and they're progressing towards the target. The countries indicated in red are showing an increase. They're moving away from the target that has been assigned to them. And the targets at country level are proportional to the size of the effort. The countries that are already quite good, the legislator does not ask them to do the same effort as the countries that have a very high antibiotic consumption. Not surprisingly, when you're putting antibiotic consumption on the x-axis and when you're putting resistance on the y-axis, the more a country uses antibiotics, the higher the percentage of infections in our surveillance systems that would be resistant to these antibiotics. The first graph is about macrolide and similar antibiotics and resistant in strep pneumonia. The right graph is about third-generation cephalosporins and resistant of E. coli to third-generation cephalosporins. And I could have made several of these graphs and they would always show the same thing. So that's why the legislator is interested in having total antibiotic consumption as an indicator because it represents 90% of the consumption in the community. The second indicator and target is about the percentage of this total consumption that is from the WHO access group of antibiotics. Access group antibiotics, they are mostly first line, sometimes second line antibiotics that offer the best therapeutic value while minimizing the potential for antimicrobial resistance. The target is 65% of total consumption. That should be from the access group by 2030. And the EU, as you see this yellow line, is progressing towards the 62%. I will not present to you all the tables by country. They are in the additional slides. And if some of you are attending today from EU member states and you're interested in the progress of your own country with these targets, then please refer to the slides after today's webinar. And for resistance, there are 3 indicators and targets. One for methicillin-resistant Staphylococcus aureus, MRSA, one for third-generation cephalosporin-resistant E. coli, and one for carbapenem-resistant Klebsiella pneumoniae. The good news is that for MRSA, and for many EU member states, but not all, the EU overall reached its target. The target is minus 15%. By 2023, the EU was at minus 17.6%. So keep an eye on it, but it's going in the right direction. Again, it's not the same for all the countries. Third-generation cephalosporin-resistant E. coli, after the decrease during the first 2 years of the COVID-19 pandemic, well, we're back up on the line that indicates the progress towards the minus 10%. And it's already an area to be attentive. And then for carbapenem-resistant Klebsiella pneumoniae, well, the EU overall and most of the member states are going against the target. There has been an almost 60% increase since 2019 as compared to the baseline. So here is something that we really need to pay attention about. For us, it's a growing threat to patient safety. Across the EU, almost all member states, these are primarily healthcare-associated infections. So what do we need to do?
Can you please come to an end slowly?
we're back to the basic: infection prevention control, prudent use of antimicrobial agents, and of course, new antimicrobial agents. But if we use the new antimicrobial agents the same way we've been doing before, and we're not enforcing infection prevention control, and we're not being more prudent with the use of a new agent, we'll get back to the same place. One important thing to know, and I wanted to include this slide from OECD, is if we invest in those prevention, this will result in savings. For the EU overall, €1 invested in this mixed package of interventions, with intervention that should not surprise you, will result on average approximately in €3 of savings. We are at the 17th European Antibiotic Awareness Day. And since 2015, we have a World Antimicrobial now AMR Awareness Week. And does it work? Does it work? I mean, repeating the same message continuously, does it work? Well, we have Eurobarometers performed by the European Commission since 2009, and you see that the knowledge of Europeans about the fact that taking antibiotics has side effects, that antibiotics are not active against cold and flu, not active against viruses, is increasing. And self-reporting use of antibiotics, the red dots, has been decreasing. It's a long journey, but for us, it's a proof that it works. Of course, we need to do this in a One Health perspective. This has started with all the discussion. There are major efforts that have been done, in particular with food-producing animals, but we certainly need to continue. Thank you for your attention.
Thank you very much, Dr. Monet, for this excellent introduction to our topic today and providing the facts, the targets, and all the work that still needs to be done. So now it's my honor to introduce the next speaker, Professor Matsabisa, who is the director of the Indigenous Knowledge System lead program at the University of the Free State in South Africa. Professor Matsabisa also, he serves on several committees, including the South African Health Products Regulatory Authority's Complementary Medicines Committee. He chairs the WHO Afro-Regional Expert Committee on Traditional Medicines for COVID-19. And he actively contributes to research and policy development on African traditional medicines and indigenous knowledge systems across Southern Africa. So great honor to have you here today, Professor Matsabisa. Over to you.
Thank you so much, Tido, and greetings to everyone. It's really also my pleasure to be here. And today I would really want to give you a snippet in terms of a project that I think we want to conceptualize as a partnership, project, on antimicrobial resistance and traditional medicines between, I think, Africa and Europe. It is a proposal, so it is not a project that has been completed. And for me to do that, really, I will not repeat, I think, what has been said, but just to give you an overview in terms of, I think, the status of antimicrobial resistance in Africa, and then talk about traditional medicines and its role, I think, in antimicrobial resistance. And then 2 slides, what the project is about and what it wants to achieve, and some take-home messages. So I think in Africa, we see that I think there is a lot of, I think, misuse and overuse of antibiotics, and that is accompanied also by lack of, I think, knowledge. And also, I think that's also another problem that people, I think, interchange and assume that microbials could actually be used as a substitute to antivirals. But again, I think we see, because of the ruralness in Africa, that people then, I think, share medicines, and they share including antibiotics. And that creates, I think, that problem of, I think, underuse. Now, what drives, antimicrobial resistance in Africa? I'll sum up. I think I said it's the overuse and the misuse. You go to a hospital, I think everybody just gives you, antibiotics for whatever reason, but also people share these medicines because of, poverty, because of ruralness and the remoteness, of some, places. If one goes to a clinic, you get brought out with some antibiotics, and you get home, you find one member of your family also, sick, you just share the medicine. That's where the problem is. I will not go through the others, but also the aspect of poor hygiene and the lack of, infection and prevention, of, control. But also there is a poor or a lack, I think, of education. So I actually liked, the theme about educate, advocate, and then act. We really need to do that in Africa because it's much easier, for GPs to just dish out, antibiotics for whatever reasons. And therefore, I think, you do that in an continent where there is very poor surveillance, in terms of, how then do we make this surveillance in terms of antimicrobial resistance? Their lack of, laboratories. So if we do not have, test laboratories, then it would be very difficult, to do the surveillance. Now, what's traditional medicine's role? I think in Africa, irrespective of whether you are in a big city like I am, people still and continue using traditional medicines. People will continue, whether you are best in an intensive care unit, your traditional instincts will continue to drive you to use traditional medicines. But there may be, some good things about it. But again, I think we just need to say, how then do we use a rational use of those traditional medicines? So in the majority, I think across Africa, over 70% of the people will, one way or the other, use traditional medicines. There are benefits in terms of traditional medicines because of the fact that they are polypharmacy. It's very difficult for microbes to develop resistance. So the tendency would be, I think, when we develop new antibiotics, we should avoid trying to find single new chemical entities because you'll fall into the same trap like the first speaker said, that if you misuse, the new antibiotics that you'll do, you're going to get into the same problem. So what is this project about? Together with Charité, we have organized, a number of countries that we collaborate with in Africa, both in Southern Africa, in West Africa, East Africa, and North Africa, that have shown interest to participate in an initial, idea about the use of, traditional medicines and microbials. But it is really for us to begin to say, let's begin to look at the capabilities. Let's begin to look at, and map what is happening in Africa, look at what is available, and therefore take stock in terms of how then best are we going to be fighting, this scourge. So this initiative, I think, is an initiative, for networks across Africa. We have been, working with South Africa, where I am, Botswana, Lesotho, Cameroon, Tanzania, Ethiopia, Eritrea, Ghana, Uganda, and also Tunisia. So a number of countries have shown an interest to say, let's participate, let's work together, and probably create up, this partnership with Europe, where we can learn, where we can also, begin, to use and discover probably, new antibiotics. So this is really a project that seeks, collaboration and partnerships with Europe to tackle antimicrobial resistance. So in summary, I think the objective, as I said, we want to map the expertise. We want to look at the resources. We want to look at, African institutions, whether it's universities, or national, health laboratories. But those should also be using, I think, in the field of traditional medicines and phytotherapy. That's, I think, the key. Then these networks, then I think we want then to identify and strengthen the research networks and the capacities, therefore to promote, I think, the effective local solutions against antimicrobial resistance. And I said, I think this is a partnership, I think, with Charity Center for Competence and Traditional and Integrative Medicine. So we're working with them, I think, as the first partner in Europe. But I think our hands are open to say, I think anyone who wants to join and, partner with us to fight, I think, antimicrobial resistance, I think, we are available. We have developed up a questionnaire that we're going to throw right through Africa in terms of, I think, gathering data on, I think, the challenges in the use of, antimicrobial. But also, I think we anticipate that, I think, through this, we will strengthen, I think, the collaboration, I think, with Europe, but also we are looking at creating up, I think, a policy paper, for Africa to begin to look at seriously, the aspect of antimicrobial resistance and the benefits, I think, are really to say, how then do we fight that? I have, I think, one or so two take-home messages. And again, antimicrobial resistance and traditional medicines, I think they all fit into, I think, the One Health, the environmental health and the planetary health. Because I think in terms of what we see antimicrobials are doing, traditional medicines, I think, are being used for animals. They are being used, I think, for people. And therefore, we see that, I think, there's a role that I think traditional medicines could play. But also we're looking at collaboration in terms of co-creation and I think, co-development, between Europe and Africa to fight antimicrobial resistance, because migration is also another factor that drives antimicrobial resistance. So it is not, I think, helpful to act, I think, in isolation or in silos, because I think, as we said, these microbes respect no, I think, political borders. The second take-home message, I think, is we need new biotics.
One more minute, please, Professor.
Thank you so much. Yes, I'm already there. We need these antibiotics because we may, I think, look at, I think, complementary and traditional medicines. As I said, this is polypharmacy, I think, herbals, and resistance may be actually very difficult, to be generated. And again, I think, if we could have this North-South, collaboration, that would be, I think, a good, I think, idea, but also considering probably taking this project as an AU-EU flagship project. I'll not go through this, I think, in terms of One Health, but what I want, I think, to relay, including this one, I think this was, part of what Germany and French did. But all these highlights, I think, one important thing, which is the number 5, the transdisciplinary and multi-sectoral collaboration, that whatever we do, we cannot work in isolation. But also, I think the world is beginning to recognize that we cannot do this without traditional knowledge. And the last, I think, message also comes from the G20, and I was fortunate to be part of the G20 from WHO Africa, and I was part of, I think, the Gujarat Declaration that was written up there. 2 messages that came out there out of the 10 points that the leaders, I think, committed to promote the One Health. But as they promote the One Health, antimicrobial resistance also came in. But the last thing about that was, there needs to be evidence-based traditional and complementary medicines in health. So all these 2 always go in partnerships. They always go, together. And therefore, we feel that a contribution of traditional and complementary, I think, medicines could play, I think, a role in mitigating against antimicrobial resistance. Thank you so much for giving us that opportunity just to share briefly, I think, the idea that we have about this continental project. Thank you.
Thank you very much, Professor Matsabisa, to broaden our view and for this exciting project. And now I'm really happy to introduce Mrs. Pammy Riggs. And I think we're particularly happy now to hear really from an agriculture perspective, because as you know, most antibiotics are used in agriculture. Pammy Riggs is a well-respected figure in the farming and food industry. She owns and runs the award-winning Providence Farm in Devon and has been a hands-on farmer and small-scale food producer for over 20 years. She's part of a team on a commercial dairy farm and is implementing year-round prevention plans on this and other dairy farms in Devon. She will share experience of introduced prevention protocols in these commercial farms. And Pammy is also the non-executive director of a very active team introducing complementary methods for better farming through the Whole Health Agriculture organization. Thank you, Pammy, for joining us, and over to you.
Hello. Thank you for inviting me, and I have someone else sharing my screen because my technical abilities are not brilliant. But I would like to say that the previous speakers ring many bells with me, and Dr. Monet, his presentation, if you were to swap infections caught in an intensive farming system to where the hospital bit was, then I think that actually his slides fit exactly with what I'm talking about. I have to say, next slide, please. For my helper, thank you. I'm part of a group of whole health agriculture folk, and I'm trained by a vet who is also a homeopath. And in that respect, I've been using the knowledge that I've gained. I've used homeopathy for many years, but this is much more formalized, and been using it as a prevention tool on farms. Farmers are really pragmatic. They're very practical. At the moment, they're badly educated about alternative stuff, but this is what we have to change, because if they see that things work, then they will adopt it. It's how we put it out there somehow. That's what we have to do. Farming is being told to prevent too much antibiotic use. All the farming papers tell them to prevent it. They are given no tools to do that, only being told to do it by increasing their husbandry or something like that. And there's only so far you can go with that. And then inevitably in an intensive situation, which dairy and pigs and poultry definitely are, and quite a lot of beef also is, then there's only so far. So I'm bringing this prevention, which is a completely new concept, into farming, which has been brought together by the whole health agriculture crowd. And just if you have a look and see how much it is costing the farmer, on average, these costings, we have so much information, and these costings are telling farmers that every case of mastitis is costing them £300. Now, if the same cow gets mastitis 3 times and you use the same antibiotics and that cow is not getting better, then inevitably, by common sense, you have antimicrobial resistance. And then you put that cow back in with everyone else, and they are there shedding those resistant bacteria. So it becomes a self-fulfilling prophecy. So if we can have the next slide, please. So if we can bring something that is active prevention into this area, then we can really, really help. Now, I've been doing this on a couple of farms, but this farm particularly, I'm very active on. It's a conventional dairy farm. I mean, my background was organic, but this is a conventional farm. There are 120 cows plus followers. So there are a lot more cows than just the 120 on the farm. They all drink from the same water source, and the preventions that I put in can be put through the water source. It really is quite easy once you know what you're doing. So if I can have the next slide, please. So on this particular farm, I took the data from the year before I went onto the farm and compared it to 1 year's worth of using prevention by homeopathic medicines on this farm. And we reduced in that time, the total reduction on that farm was 24% of antibiotic use, case-by-case antibiotic use. A bit for lameness, huge in the mastitis area, and then milk fever we've practically knocked on the head. Now that in itself makes life easier for the farmer and for the workers on the farm. We're on to the next year, and this trend has continued. As the cows build resilience, they get better and better, which is marvelous and not as I say, it's not difficult to do. Can we go on from there, please? Next slide. Thank you. There's so much data in agriculture these days, particularly in the dairy world. So much data, and we have the data, but then it's not particularly used particularly well. We just got told out of 100 cows, inevitably, in a good sense, you're going to get 15 cows with mastitis in a year. A bad farm, up to 70 out of those cows may have mastitis, which is an appalling record, really. Now, after a year of using the prevention protocols that I've put in, I've picked out a few of these cows, and I won't take you through this enormously, but it's measuring the infection levels in an udder. The udder is where the milk comes from. This is your food chain. So it's very important because we're talking about the food chain. Everybody eats. So everybody is affected by this. If you have a look at the pink line, that is the level of infection, an average level of infection in a particular cow for the year before I put prevention in. The next line to it, the yellow one, shows the level of infection after a year of prevention treatment. So there are 6 cows there, and each time the level of infection has dropped. Now that's only 6. I couldn't show you the 100, but the general trend is towards dropping this infection. The higher the infection goes, the more likely you are to get a mastitis. If you get a mastitis, then inevitably you have to treat it. Otherwise, it's a welfare issue. And so therefore, you come straight back to your antibiotics. So if we can, by these prevention methods, reduce these infections, then we are reducing the antibiotic use on those farms. And this could be rolled out over many farms. Next slide, please. So a lot of it is to do with just mitigating stress. Inevitably, on an intensive farm, we've removed the natural way of the cow living or the animals are living, and so we introduce stress. So we're not just aiming at the infection, we're aiming at the whole life of the cow. This is a whole health approach. Next, please. So what do we need to do? Well, we've got the education in place. We need to roll it out towards more of the farmers. Encourage them by making them realize they can save a lot of money and they can be much more effective and efficient in their farming. There are a lot of changes in farming now. So now let's put in one very good, benign change at the same time. So just one other thing to say is that if you give antibiotics to your animals, inevitably that comes out in the dung and then ends up in the environment. And I think we have a speaker coming saying how important it is that we maintain our biome. So I'd just like to leave it there and say, I hope this goes forward. Bye.
Thank you so much, Ms. Rick. Can you just clarify what was part of your intervention? You mentioned homeopathy. You mentioned reducing stress levels. Can you just briefly sum this up? For me, it was not entirely clear. What's the part of the package?
Yeah. Oh, yes. I use homeopathy in a preventative method, but the homeopathy itself addresses stress. If I was to give somebody who was grieving Ignatia, just as one example, then the level of their stress would reduce. If they were fearful, I could give them aconite, and the level of that stress would reduce. So it is not by changing something in the farming, it is by changing the attitude and resilience of the cow to those stresses. And the same is true of the antibiotics.
Okay. No, thank you so much for clarifying that for us. Excellent. I'm now heading over to Professor Ivan Ivanov, who has a wide range of experience in molecular biology, microbiology, and genetics. He is the head of the National Reference Laboratory for Control and Monitoring of Antibiotic Resistance at the National Center for Infectious and Parasitic Diseases in Sofia, Bulgaria. Over to you, Professor Ivanov. And
thank you very much.
Speakers, please stick to the 7 minutes. So
absolutely.
Thank you.
Thanks. So in this short presentation, I'll just make some overview of the biodiversity aspects on antimicrobial resistance and the real problem with biodiversity loss in the global scale. So we all know about this problem, but few people actually realize that this has been designated as one of the triple planet crisis by the UN a few years ago. And actually, it is now estimated that with the expansion of human population and more land converted to human use, several a few years from now, we will encounter a real problem with biodiversity loss and moreover the microbial diversity loss, which we all see now as a problem connected to antimicrobial resistance. When we speak with biodiversity, we should know that there are different levels of biodiversity. First is the genetic diversity, species diversity, and ecosystem diversity. I will not put some more details on this. It's a well-known concept, but all of these levels are interconnected with the problem of AMR, and there are currently a few studies on it, and this representation here, which is called the revised FMB or Fauci Morris Bernardo Cravo pyramid, which is very good representation of the interactions of host microbiome, pathogens, environment, disease, immune systems, and so on. So if you have time, I'll suggest to refer to this study. It's really interesting on this problem. Then when we speak about the individual microbiome and AMR, it is already that there are substantial amount of data that confirm the role of microbiome and the protection of spread of resistance. For example, we now know that the so-called healthy microbiome protects against the multi-drug resistant pathogens. As we all know that prior to infection, the colonization is occurred. So if our gut is colonized with so-called good bacteria, then the bad ones carrying these resistance genes would have some problems colonizing the human gut. So vice versa, the unhealthy microbiome could serve as a reservoir, and moreover, the dissemination of antimicrobial resistance. I present here several studies. I'll not. There's no time to put some more details on it, but it is now known that actually the human skin microbiome already represents the global problem with the loss of diversity. So this is really a good representation of the problem. Then a good tendency already is that in the new issue of WHO's antibacterial agents in clinical and preclinical development that was published a few months from now. It is here we can see that in just 2017 there was only 9 non-traditional agents in the pipeline for development, whereas in the last year we have already 30 agents, antibacterial agents that are not conventional antibiotics as we know it from the past. I should say here that non-traditional in the sense of infectology is not the same as you put the sense here in traditional medicine. So non-traditional in the infectious diseases is actually traditional in the sense of integrative medicine. So here we have good examples. For example, 3 new microbiome modulating agents have been approved for usage in USA from FDA. So we have one new oligosaccharide extracted from marine algae that have very good anti-biofilm activity and has some implication in therapy in cystic fibrosis. So we have a good tendency now to switch from the traditional antibacterials to non-traditional ones. Then we should speak some more about the biodiversity loss in the sense of ecosystem and the global sense. So we now know that for example, in the soil, the more abundant the diversity, the less amount of antimicrobial resistance genes that observed. Vice versa, when we have more dynamic habitats, for example, in the river beds and rivers, when there are more dynamic flows, we can see more impact for antimicrobial pollution, and more antimicrobial genes can be detected. So what are in a snapshot, what could be the measures and initiatives to restore the environmental biodiversity? First, improved surveillance is the utmost importance, as the surveillance is the basis of every other effort that could be performed, as it provides data that critical for for the involvement of other measures. For example, here we can put some more efforts on wastewater plants upgrades. For example, in my country, there are only a few of these water plants that are upgraded enough to clear antimicrobials in substantial degree. So a lot of antimicrobials are actually put in the environment from these facilities. Then we have the antimicrobial stewardship, as we all know in hospitals. This is a measure for a rational use of antimicrobials in the sense of ecosystems and global measure. It could help in minimizing the collateral damage done by extended spectrum antimicrobials, and then we could put some more support for the achievements of the so-called United Nations Sustainable Development Goals. These are 17 goals developed by the United Nations, and they all, as a whole, could help in achieving some progress in combating the antimicrobial resistance.
It's come to a close.
Yeah, of course. And this slide is just to remind that the burden and the lethal impact of the antimicrobial resistance is far beyond the combined burden of malaria, TB, and HIV, and yet its financial degree is much lesser than these fields. So new financial models are crucial for the future development of these measures. So some key takeaways. Most of this I have already said. It's crucial to restore and maintain the normal microbial diversity on all levels, as I mentioned. Of course, there is a high need for high quality research on the alternative and traditional medicines and antimicrobial therapies to minimize the damage to the natural microbiomes. And of course, it could be useful to incorporate the principles of holistic and integrative medicine into all aspects of the problem, such that we should not focus on certain elements, but look at it as a whole. Thank you very much.
I would like now we're going to talk about AMR research, and we have two speakers on this. And so first we'll here now Dr. Esther van der Werf, who is a senior epidemiologist with over 20 years of research experience. She currently serves as a clinical research lead at the Homeopathy Research Institute in London and holds the positions of honorary senior lecturer in primary care infection at the Bristol Medical School and is a visiting research fellow of the Australian Research Centre for Complementary Integrative Medicine. Over to you, Esther.
Thank you very much, Tito, for this kind introduction. I'm very pleased to get the opportunity to talk about the scientific status of TCIH for prevention and treatment of infections, and I will show you some examples of high-quality studies. So TCIH prevention and treatment of infection strategies are commonly used already in human and veterinary medicine, and this is already based on an increasing number of scientific studies. However, what we do need to understand is that not all study evidence is the same. And appraising the level of evidence is part of evidence-based medicine. So normally the hierarchy of evidence is represented as a pyramid with smaller, weaker research studies near the base of the pyramid, and then the better studies, the high-quality studies, at the top of a pyramid. So this is the pyramid I'm talking about. And as you can see, meta-analysis, systematic reviews, and individual randomized controlled trials are on the top of this pyramid, showing a high quality of evidence. And it is this level of evidence that provides the strength or just the recommendation for a specific study result to be included in a clinical guideline or in clinical decision-making. So we'll show you some examples of high-quality studies, starting with the highest level of evidence, systematic reviews and meta-analysis. Well, back already in 2017, you et al. Conducted a systematic review and meta-analysis to determine the effectiveness of Enterographis paniculata for respiratory tract infections, RTIs. And they searched English and Chinese databases just for eligible randomized clinical trials evaluating the oral use of paniculata without any language barriers. And they stated their primary outcome as the improvement in acute RTI symptoms and adverse events. The researchers included 33 randomized clinical trials, and based on these 32 trials, they concluded their results that Enterographis improved cough and a sore throat when compared to placebo. They also found that Enterographis shortened the duration of cough, shortened the duration of a sore throat and sick leave, as well as time to resolution when compared versus usual care. They also found that there were no major adverse events. So based on this systematic review and meta-analysis, we can conclude that Enterographis appears to be beneficial and safe for relieving acute RTI symptoms and shortening time to symptom resolution. The next step as a recommendation is now, of course, to do a very good, well-designed trial to evaluate the potential role of Enterographis to reduce antibiotic use. Another systematic review I would like to present to you is an updated Cochrane review. This is updated until March 2023, and it includes randomized clinical trials of cranberry products. These studies are compared to either placebo or to no treatment or to another intervention like an antibiotic or a probiotic to prevent urinary tract infections, UTIs. And the researchers showed that the cranberry products reduced the risk of getting a UTI in 3 specific groups. These are women with recurrent urinary tract infections, children, and in people with a susceptibility to UTIs due to a previous intervention they had. They also compared the effectiveness of cranberries to an antibiotic prophylaxis. And they found that the cranberry products made little or no difference to the risk of getting a urinary tract infection. And this is based on 2 large studies. So the researchers concluded that we do have data that support the use of cranberry products. And this is interesting because less urinary tract infections already means less use of antibiotics, because urinary tract infections are the most commonly indicated, common indication for an antibiotic in primary care for women. So there is now need for a new study or maybe a replication of an existing study to strengthen the evidence of the potential role for cranberry products in reducing antibiotic use. Next study I would like to focus on is just a level lower, is a double-blind randomized clinical trial, including an economic evaluation. So this is a double-blind randomized clinical trial testing an homeopathic medicinal product. And in this study, 130 patients were included, aged 18 and 60 years old, and they were included with a radiographic acute sinusitis confirmation. So the treatment group that received Synfrontal, there were 57 patients in, and in the placebo group there were 56. Sorry. So the participants received either Synfrontal or a METS placebo over a period of up to 22 days using a fixed schedule. And the researchers found that from day 0 to 7, Synfrontal caused a significant reduction in the sinusitis symptom severity score compared to the use of a placebo. It also found that there was an improvement in the radiographic and clinical cure and other health outcomes, all following the trend in favor of a homeopathy group. And interesting, the researchers used this data for a secondary analysis to do an economic evaluation. And they found that the Synfrontal, so the homeopathic product, led to an incremental saving of €275 per patient compared to a placebo over 22 days. They also compared the effectiveness with the antibacterials. And Synfrontal had a significantly higher cure rate, 11% in the antibiotic group and 59% in homeopathy group at similar or lower costs. Then the last study I would like to present is an observational study. And in this study, we investigated the differences in antibiotic prescription rates between conventional GP surgeries and GP surgeries employing a GP additionally trained in TCIM, all working within the National Health Service in England. And we used a retrospective study design on antibiotic prescription rates for RTIs and UTIs. We included more than 7,000 NHS GP surgeries in England, and we used the data of 2016. Well, in this study, we found 9 integrative medicine GP surgeries that were all comparable to the other conventional GP surgeries. So they were comparable in their list size, in their demographics, in their deprivation score, comorbidity prevalence. And what we found is that the patients consulting an integrative medicine surgery were 22% less likely to get any antibiotic prescription, and also 26% less likely to receive an RTI-specific antibiotic prescription than those who consulted a conventional GP surgery. We did not find any statistically significant numbers in UTI-specific antibiotic prescriptions. So my take-home message is about the potential role of TCIH in AMR is that there is already high-quality research evidence indicating that TCIH can help to prevent and treat infections and to reduce the use of antibiotics in daily clinical practice. And this is exemplified by systematic reviews, by meta-analysis, by individual randomized clinical trials, real-world evidence studies, all on the top of the quality of evidence as shown by the pyramid. What is necessary to really explore the full potential of TCIH? What could it play in helping to solve the problem of AMR is really more funding for high-quality research and worldwide collaboration. So thank you very much for your attention.
Thank you very much, Esther, for your clear presentation and thanks for staying in time as well. Now handing over to Professor Eric Baas, who's an epidemiologist and an MD. He is a professor of anthroposophic medicine at the University of Applied Sciences in Leiden and a researcher at the Louis Bolk Institute in the Netherlands. He leads an international research project exploring the role of anthroposophic and complementary medicines in combating infections and addressing antibiotic resistance. Over to you, Eric, please.
Thank you, Tito. Yes, so in short period, I will tell you a little bit about the project we had.
It's called the GIFTS AMR project, and it was funded by JPI AMR. And it shows several things on research agendas and a comparison to other research agendas, which were made up already in 2023 by the WHO and the WHO, FAO, UNEP, and WAOAH research agendas. So very quickly, where it comes from, it's a funding, network funding from JPI AMR. It's called GIFTS AMR, Global Initiative for Traditional Solutions to Antimicrobial Resistance. And it involved 32 research institutes and 6 additional organizations in 17 countries. And we had the competence of researchers from preclinical and clinical expertise, and also TCIH experts with several TCIH types: anthroposophic medicine, Ayurveda, homeopathy, phytotherapy, and traditional Chinese medicine. And the aims we had were to develop a global network on this field, to develop research agendas, also to prepare grant proposals, and to communicate all these issues to the network, but also in an international conference, and furthermore. So this is the front page of the research agenda we have been developing. And it's about strategies and natural medicinal products to prevent and treat infections, to reduce antimicrobial resistance, with the primary focus on health promotion. So if you will have a look in the research agenda, you will find the following chapters. First of all, we described what is the value of TCIH medicinal products, because it's something else than antibiotics. So what is the specific value? Second one is about what are the best TCIH product market combinations. So at the one side, which are the products which are most promising, and on the other hand, what's the market, where is the need for other solutions, for example. Third one, what are the most promising TCIH medicinal products which we can use to do high quality randomized controlled trials, as Esther already said. And then there is a lot of limited evidence, and we think that we can still make use of products when there is limited evidence and real-world evidence on safety and effectiveness, and how you can use this also given the importance and given the urgency and need for other solutions. Then we had a chapter on the transition towards full integration of TCIH in the medical system and increasing the accessibility of TCIH medicinal products for prevention and the information on that. So that were the chapters. We also made a comparison to the other research agendas, and I just go very briefly to it. The WHO AMR research agendas has several themes, and I just want to show that we have identified that we have additional information, additional projects, interests on 3 themes. The first one is in prevention. The second one is on treatment and care, and the other one is about what is the chapter in this WHO AMR research agenda, what is called cross-cutting. So it's, for example, about infection prevention control, antimicrobial use and consumption, and resistance awareness and education. The same we did for the pillars of the other research agenda, which was presented in 2023, and you see here the areas where we have to where we can contribute from TCIH. So it's about interventions, about the pillar on transmission, on interventions, methodology development, and on behavioral insights and change. What we also did was have a look, are there any new research themes and priorities which are not described in the other 2 research agendas, global research agendas of 2023? And yes, we identified these. And the first one is about patient preferences and stakeholders' needs. And we said, well, it would be good to assess patients, animal owners, farmers' preferences, use, satisfactions, and acceptability of these TCIH medicinal products in the low middle income countries and in developed countries. Also investigate the feasibility and acceptability of integrating traditional complementary approaches with conventional primary health care, and also investigate types and working mechanisms. of these TCIH medicinal products. Other one is about the use of limited evidence and real-world evidence. So we described methods how we could use this. I do not go into this in detail, but it's making use of the evidence which is there already. Then we also have identified that we could study further on implementation information tools and additional investigating conceptual differences between conventional medicines and TCIH, which present a barrier specifically for acceptability and implementation. So it would be good to focus on that in a research agenda.
Can you come to a close, Eric?
Yes, I come to the closer. So we identified 2 health research priorities. So look at the benefit-risk ratios, benefit-cost ratios, looking for humans, animals, and the environments, and also look at the effects of not only specific interventions, but also on whole system approaches like organic, biodynamic agriculture, and TCIH whole medical systems. In the agenda, you also find suggested advocacy actions for research development, policy, and healthcare systems. So there is a call for action. The global TCIH research agenda is there. We just need your support to implement it. Here, just as a closure, the contributing countries on the map, and on the left, you will find the names of the countries which contributed to this. So thank you very much for your attention. I put in the left corner the where you can find and download the research agenda. So thank you for your attention.
Thank you very much, Eric. So we now have some time for Q&A that Adrian and me will be leading, and some questions coming through the Q&A as well. I'm really happy about the panel we have today because we're really looking at medicine, we're looking at agriculture, biodiversity. So I think today we really have a One Health approach. And I just want to pose a question to Professor Ivanov and Ms. Riggs, more about the role of organic farming. I mean, there, as you probably know, since the 70s in Switzerland, there's this long-term experiment comparing biodynamic, organic, and conventional farming and showing increased biodiversity and improvements in the soil. So how to kind of scale up the learnings we have so far from this veterinary practice and organic farming to also better impact AMR. What are your thoughts?
Well, I was a registered organic farmer for more than 2 decades, so I understand its importance. But from the farmer's point of view, it comes down to the bottom line. Will they be being paid for the produce that they are producing? Do we think that organic and biodynamic, because I've been involved with the biodynamic group as well, are having enough clout? It's very hard in the food chain because actually there's so much is given over to cheap food, and people have to eat. So while in a perfect world, yes, we'd love everything to be moving in that direction. Possibly the regenerative movement, which has no proper boundaries on either side, but has a sort of general mental feeling as if it's going more towards biodiversity and using more than just 1 or 2 crops. It's a wobbly one there. I'd love everyone to be organic, but how are you going to make people pay for it? This is the thing. Meanwhile, even when they're not paying for it, then we have other tools at our disposal to make the things that are working or can work, even with the systems we've got, make them work, and then let the farmers see that this works. And so it's like thin end of the wedge thing. If I can make something work on any farm, surely that opens up someone's eyes to something a little bit more natural. This, to me, talking today, it is a huge, big natural resource that we are not tapping into. It's such a shame.
Thank you. Wow, thank you for bringing this very practical and pragmatic perspective. Professor Ivanov, any comments on this?
Organic farming is really a tool for increasing soil diversity, and there are a lot of data already confirming that limiting the use of pesticides and other chemicals could really improve the soil qualities in the sense of good diversity. But unfortunately, the organic farming is also requires, as my opinion, is more territory, more land. So the crops, as you know, are quite more limited than the conventional ones. So in this sense, we could increase the problem with the territory and the landing. So there is a 2 point of this problem.
Very good, thank you. Adriana, I hand over to you.
Wonderful, thank you. I do have actually a question for Dr. Dominique Monet. So in your presentation, you highlighted the evolving trends in antimicrobial consumption and resistance. So what I would like to ask you, how could the European Union better support member states in meeting the 2030 targets outlined in the Council recommendations? So what would you see as the best ways to ensure that health policy intercepts the added value of TCIH in tackling AMR?
One thing first, thank you for the question. One thing about organic farming first. Systematic review. Consumption of organic food may reduce exposure to antibiotic-resistant bacteria. The risk for isolating resistant bacteria resistant to 3 or more antibiotics was higher in conventional than organic chicken and pork. Okay, so that's another, we're focusing on antimicrobial resistance today. So I wanted to, there are plenty of issues, and is this sustainable? Is this provides revenues to the farmers? But obviously there's a link between farming and less resistance. Now, what can the EU do? Risk management is a competence of each individual member state in the EU. Means prevention and control is not a responsibility of ECDC as an agency, and it's actually not a responsibility of the European Commission. So what can we do to help the member states? As part of the regulation on serious cross-border threats to health that was adopted in 2022, ECDC must conduct country visits that are assessments of the level of preparedness of each member state. And all the EU member states must be visited over a period of 3 years. That's a huge effort. And we're lucky that as part of this country visit, we have a substantial part which is on antimicrobial resistance and healthcare-associated infection. So which means we can give feedback to the country and say, look, you've been trying to do this, but maybe you could do it in a slightly different way, or there's a key element that you should have in place and it's currently not in place. Mm-hmm. Beside this, what we're doing at ECDC are we're conducting more broader country visit with a focus on antimicrobial resistance. The preparedness visit that I mentioned, they cover all areas of communicable diseases, with a substantial focus on antimicrobial resistance and healthcare-associated infections, but there are many other areas. Mm-hmm. We at ECDC are conducting country visits that take 1 week upon invitation, and they just focus on AMR. Okay, and today we're publishing a report about Greece, and you can find this. What's the situation on antimicrobial resistance in Greece and in Greek hospitals? It's a strong report. Okay. And hopefully it will be helpful to Greece. Thank you.
Very clear. Thank you so much. Let me ask Emily another question that came in the Q&A from Sasha Marchang. He's from the European Hospital and Healthcare Federation. So he asked the following. So hospitals and healthcare facilities experience underfunding, short staff, and high turnovers, so which can complicate effective infection prevention and control. There's also a lack of data on transmission dynamics between community and healthcare settings. So do you see any role for TCIH in supporting the measures that Dr. Monet mentioned for reducing healthcare associated infections, with maybe some concrete examples? I think this question could be asked best maybe to Dr. Esther van der Werf or Professor Dr. Erik Baars, is willing to answer this question.
Putting you on the spot there.
Oh. Is there anyone maybe willing to get into this question? If not right away, we will put this on hold and maybe go further with the next question and maybe come back on it.
Yes, indeed. So yeah, I had a question for you, Professor Matsubisa, and it's about on one hand, what do you expect from this survey? From how will it help and generate further work? And secondly, also, do you already know of some really promising examples in the African or particular Southern African region where a collaboration between traditional and conventional medicine on infections is productively practiced?
Tito, thank you so much. What do we hope the benefits would be in terms of the collaboration? And it's really about, I think, exchange of knowledge, exchange of expertise. Countries in Africa are at different levels. And we are hoping that, I think, through mapping and finding out these expertises, we can at least try and see how then do we sort of bring, I think, the countries to a level, that would be, I think, acceptable. We see a lot of movements of people across countries, and that creates a problem, I think, in terms of, I think, the burden they put into the health systems, the burden they put, I think, in terms of antimicrobial resistance. Partnerships, I think, with communities, traditional healers, and I think, doctors. It's not institutionalized. It does happen. I think there are certain doctors that are, I think, open and amenable, I think, to working, I think, with traditional health practitioners. But that landscape is actually changing for the better. A lot of countries are beginning now to recognize and accept that indeed, I think there is a role that traditional and complementary medicines, could play, and that it should actually be given, I think, that space. I think one of those countries is my country. It's becoming open to them. I know some other countries like Botswana. I think I'm doing a project there with them. They are also open to it. So we're hoping really this project will then, I think, help in that, policy direction to say there is a need, for collaboration. There is a need, I think, to look at the contribution of traditional and complementary medicines. That's what we hope, we can get out of this project. It is a first step, but there will be, I think, the second phases thereafter.
Very good. Thank you. Esther, Erik, any thoughts you wanted to add, maybe to the difficult question or anything else before we then give the floor to Dr. Monet and we'll be closing?
And Esther, sir, yes.
No, so my connection was not really good anymore, so I didn't understand or hear the question in full. I'm not sure whether Erik did hear the question. Maybe just if you can repeat the question and we can reply, because I missed the question.
It's actually on the role of TCIH in supporting reducing the healthcare associated infections. It was a question from the European Hospitals Association.
Okay, well, I think that's not my area of expertise, so I think it's not up to me to give a reliable answer to that one. So I will pass that one.
Okay.
Erik, maybe you?
No, same for me.
Okay.
No.
Well, we don't have to be able to answer all the questions here today. It's good
Well,
to have more open questions.
I would like to maybe give my view on this because since I work in an hospital setting as an acupuncturist, I see that working on the resilience of the people really help very much to get them stronger and better prepared for like external pathogen factors. So that actually helps a lot. But besides traditional Chinese medicine, you also have other modalities like body work, movements, yoga. That's, I think, very important to include in healthcare settings and hospitals. So that's my view on this question. But yes, so Tito is, I think.
Oh, very good. Thank you for coming in. Dr. Monet, you have the floor, and then Adrian, I'll let you close.
Yeah, I will be a bit more reserved about the role of those medicines in preventing healthcare-associated infections. Healthcare-associated infections is about being submitted to procedures, maybe long-term hospitalization, having devices put into your body to help you live. And if a multi-drug resistant bacterium get into these devices or enter in your body and give you an infection, I cannot have difficulty seeing a role for a traditional complementary integrative medicine. But the role of TCIH is really in the community. If this can prevent unnecessary antibiotic prescription for mild infections, that in certain situations, certain countries may lead to an antibiotics. If we could replace the antibiotics by something else, and this is a personal view, okay, it's difficult for me to speak about this, but I see a role there. And you see that any antibiotic prescription that we can prevent will result in less antibiotic consumption, and as per the graphs and the data that we have, less antimicrobial resistance outside of hospitals. Okay, I think that's where the role is. Thank you.
Thank you, Dr. Monet. I may add there is some data also of some hospitals using integrative or complementary medicine prescribing less antibiotics. So at least in, I think, antibiotic stewardship, this could be a tool. But I agree with you, of course, when you're talking about invasive procedures, etc. I mean, here we're talking about hospital hygiene and everything else that is needed. Thank you. Over to you, Adrian, to close the session for today.
All right. Okay. So thank you to everyone for joining us today to this important discussion on how traditional and complementary integrative healthcare can contribute to tackling antimicrobial resistance within the One Health framework. So I would like to express my gratitude to all the speakers. So Dr. Dominique Monet, Professor Dr. Motlale Pola Matsabisa, Pammy Briggs, Dr. Ivan Ivanov, Dr. Esther van der Werf, and Professor Dr. Erik Baars for their invaluable contributions. So your expertise have really given insights and deepened our understanding of the gaps in the current strategies and the role that TCIH can play in addressing the issue of AMR and advancing global health. So as we have heard today, AMR is a complex challenge that requires a multi-sectoral One Health approach, including the integration of TCIH. The One Health perspective reminds us that tackling AMR is not only a human health issue, but a broader ecological, societal concern that demands collaboration across sectors and borders. So the contribution of TCIH to AMR strategies are more than promising, and we believe that with continued research and collaboration, these practices can become a key part of the strategies to address AMR in Europe and globally. EuroChem is committed to advocating for the inclusion of TCIH into healthcare systems and also in the societies. And we look forward working with all of you to ensure that these approaches are recognized and supported. So as we move to the EU 2030 AMR targets and targets of global strategies, it is clear that a united collaborative effort across Europe, Africa, and beyond will be essential. So we encourage every one of you to stay engaged and continue this conversation, moving from declaration to implementation, particularly as we work to build a more sustainable and inclusive healthcare landscape. So once again, thank you all. Thank you for all the speakers, the attendees, and partners for making today's webinar impactful and engaging. So we look forward to continuing this journey together and invite you to join us for our future activities as we work to advance the role of TCIH in addressing today's health challenges. So we look forward to staying in touch regarding Eurocam's Refocusing Health project, and we do hope to see you at our upcoming events.